you can give them the best source of information.
Okay, everyone, welcome to the Monday, May 4th briefing here. Thanks so much for being on. Hope everyone had a nice weekend. Just to note, we have David Silverman with us, from County Counsel's office, who really is familiar with the orders. If there's any questions on the order, we can certainly update you as to his thoughts on them. He was involved in developing the FAQs, his team, and certainly involved in the development, drafting of them. So we are just approaching 1,300 positive confirmed cases in San Mateo County. We're holding at 51 deaths. Just a health update, the congregate care facility outreach continues, and that's really a priority. In fact, we should get, I think we've got 5,000 test kits coming into public health, hopefully today at some point in time. Is the largest shipment that we've received. Is an indication that hopefully the supply chain is being loosened up and established. We've actually requested 50,000, and we will continue to request many as we try to reach 200 per 100,000 residents daily of testing. And we hope to have more information on that shortly. So we do hope that this week will bring a renewed hope on the supply chain, and that we'll get those tests going more holistically throughout the community. And we will keep you updated on that. We should know more by Wednesday. And the health officer has a new statement, which is posted at the www.smchealth.org. So I encourage you to take a look at that. There are a couple updates there from the last one. So I ask you to take a look at that and see how that differs. Just a couple updates. A written notice that landlords wishing to increase rent must first provide their tenants information is now posted on our website along with FAQs. So that is a new area. And also just want to, I think many of you are out there, but if you can pull up the photo of this morning. Really is a great event at the San Mateo Medical Center. Certainly Congressman Spear and Kevin Mullen and Senator Hill were out there really honoring with a lot of the elected officials in the county, honoring all those in the healthcare industry for all that they do and have done throughout this crisis. They are really the unsung heroes, showing up every day. And it's amazing. We had an opportunity to look at the board meeting of all the planning that's gone into this, the health plan or the health system board meetings today, health center board meeting today, and all the planning that's gone into this and how they're handling this crisis is absolutely amazing. And it was certainly fitting that we were out there this morning honoring them, recognizing them. Certainly Chief Barberini and from the police department and Chief Ray Iverson from the fire department did an outstanding job bringing folks together to really let these folks know how much we care about them and honor them officially. So good to see that. On the homeless front, we do have 61 clients who are sheltered at the Bayfront Station. We're using 52 rooms now, so we're getting close to the capacity in those rooms, but we still have higher need, and we're getting people, we have an opportunity to get people into the shelter. We're doing that as we can. We're checking on people, continue to check on the homeless out in the field with our outreach team, the hot outreach team. And we still have some clients on the high risk side of things that we're trying to get into hotel rooms, and we'll continue to move in that direction. Just on the other front, and this is just the other thing that we reported out today, is that San Mateo County continues to hold the #1 spot for the highest response rate on Census 2020 in the state, and we want to finish with the highest at the end of this. We're at 66.3%, well above California average of 57.5 and the national average of 56.3. LA Point showed the response rate by city. San Carlos leads that. They're in the top 10, 76.3 in the state. So great job by them. If you go back to the slides just really quickly, just wanted to highlight a couple of things, and that is that certainly it's good to see our hospitalization rate is coming down 60 to 61 as of today. ICU beds availability is flipping a little bit and going up, and certainly ventilators in surge space is doing very well. So that's really it for today. It's really not much to report other than we are making some inroads on swabs. That is, as you know, one of the legs of the stool that's absolutely imperative, that we have enough test kits to do more holistic-based testing, and we want to make sure that we get out to as many of the society as we can. The concentration will, of course, be on the residential care facilities at first, in those congregate care living situations, and that is a focus for our staff right now, and that's where they will be focusing. Second leg of the stool is the PPE. We hope to report back this week. I think we've got 100,000 coming in, 100,000 coming in today potentially. We want to inspect them to make sure that they are all good masks, because we've heard of some showing up in other agencies that are not good and have to be sent back. So, but we should have a lot more coming in the near future. But it's all starting to come together, and then the contact tracing is the third leg of the stool that's very important, and we are putting that process in place. We have capacity right now, excess capacity right now. We're going to get more people trained to make sure that we have really excess capacity and get ahead of this, much like we've done on surge space within the county. So that is all I have. We have no questions that were submitted today. I don't see, maybe we have one question in the box, but Elliot, do you want to go ahead with that question?
Sure. Testing, any progress on reducing, so regarding testing, is there any progress on reducing the amount of symptoms which must be shown to be eligible for testing?
Yeah, that's a function of the amount of tests that we have kits available. And I hope, and it is our hope, as soon as we get an abundance of those test kits in, that we can loosen those standards. And again, not only on the, really for us on the we'd love to get everyone tested, but if you have a hierarchy of testing, you want to get those in the residential care facilities tested, you want to get those in health tested, you certainly want to get our first responders tested, but then you want to get those essential services employees tested, our grocery store folks who have high touch. And now you know that after hearing the governor, it sounds like things will start to loosen this week. We want to make sure that we have availability of testing for all of those who are in high contact with the public. So we look forward to that. And hopefully by Wednesday, I'll have good news on that, reporting that, we have, we now can tell you how many test kits we can see in the future and how much testing we'll be able to do in the future. So we look forward to that. With that, it looks like no other questions, no hands raised. So just a brief briefing today. Not much has changed, but thank you all for being on the call, and we will see you on Wednesday.